Hi, everybody, and welcome to episode 50 of the Pet Behavior Chat. So today is a super exciting episode for me because it's a topic that I absolutely love, and that is all about psychotropic medication. And there are some other kind of terms or words for psychotropic medication. They're also called psychopharmaceutical medications. They're also called behavior medications. They're called behavior altering medications. So lots and lots of different AKAs. I quite like the term psychotropic. I also quite like the term psychopharmaceutical, and I'll use those interchangeably. So if I'm talking about those, you'll know exactly what I mean. And so I'm going to give you a bit of a whistle-stop tour through the medications. It's a huge, huge topic, and we're going to break it down piece by piece, probably in kind of the second year of our podcast, because we're almost at episode 52, which means we've almost done a year's worth of content, which is amazing. And also next week, I'm going to have another episode about psychotropic medications, looking at the difference between short-acting and long-acting medications. So we're going to start kind of building up the layers all around kind of psychotropic medications. And I think these episodes are really valuable for both pet caregivers, so pet parents, who have kind of been asking themselves the question, would medication be an option for my pet? But obviously also very much for the veterinary team. So for vets, for veterinary nurses, for dog trainers, other pet care professionals that would like to know a little bit more about these medications and would like to kind of understand which are the patients that might be good candidates for this, because that's a really important piece, is understanding which patient might benefit from them, because only when we use them correctly and we find the right patients that we think they're actually going to make a difference to, can we use them in an ethical and responsible way. So that's really, really important to me. And that's why on this episode of the podcast, I'm going to give you my top 5 tips of identifying in what situations and in what patients these medications might be really useful. At the end of the podcast, I'm going to give you a little bit of a spoiler alert of something big that's coming. But for now, I think let's just delve right in. So top 5 tips. So actually, I'm going to start with the first thing I start with. And as if you've listened to a few of these podcasts, I always like to give definitions. I always like to help you understand what we're actually talking about. So we're going to start off with a definition of what a psychotropic medication is. And psychotropic medications can alter a patient's mental state. So what does that mean? So it can alter their mood. It can alter how they perhaps think and process things, and ultimately can change and alter behavior. We obviously want them to improve behavior, but they basically affect the way, I guess, the world is perceived, and those all important things such as mood state, but also sleep wake cycles, in improving sleep quality. So anything that the brain is really responsible for and that might not be working as well as it should be. So those are all the areas that psychotropic medications can influence. So it's all to do with brain state, with mental state, with thinking, with perceiving, and ultimately, therefore, with behavior. So that's a little bit of a definition to get us started. So the second point that I want to delve into is the importance of obtaining a correct diagnosis. This is the absolute foundation of using psychotropic medications, because if we don't have a good working diagnosis, or at least what we think is the right diagnosis, because that's not always easy in the behavior world, as we know, because our patients can't speak to us. So there might be some nuances that we miss. So we rely heavily on observation, on reading body language. But essentially, we want to have a good working diagnosis in order to understand, A, whether psychotropic medications are going to be useful and indicated, and B, what type of medication do we want to use? And also, what do we want the outcome to be? What are we hoping to achieve? So let me give you some examples here. So, for example, if we are kind of clear on a diagnosis, let's say, for example, on separation-related behaviors or separation anxiety, then we understand what we would like to achieve. So what we would like to achieve is to reduce the global fear and anxiety in our patients. And we specifically want to achieve a result around those departure events. So we want to help the animal feel calmer, more relaxed, able to process, able to think, to reduce panic, to reduce those high levels of anxiety, and therefore also the behaviors that go with that. So by really identifying that diagnosis and knowing what we want to achieve, that already puts us on a really good footing in terms of what medications we might want to choose and what can actually help us in that case. Similarly, let me give you another example. If we have a very quote unquote reactive dog, so a dog that is very impulsive, that has high levels of arousal around certain triggers, maybe when they see other dogs, maybe when we have visitors coming to the home. Those are sort of, some of the classic presentations. We want to understand, what do we actually want that dog to do? So we want to achieve a behavior change in that they don't respond so quickly and so impulsively and so reflectively. So we want them to actually think and process more slowly. We want them to make better decisions. We want to target some of the areas of the brain that are perhaps being circumvented at this point in time. So we really want to understand what we want to achieve, and we need to understand the neurotransmitters that are involved with that. So getting a diagnosis is massively, massively important if we're to have any chance of choosing the right medication, of discussing with our clients, what do we want to achieve and what do we want the outcome to be. So that's really important. And obviously, and I harp on about this all the time, we want to make sure that we're ruling out any physical medical contributions, because only if we have that really comprehensive holistic picture of the animal's full health, so that means their physical, their mental and their emotional health, can we achieve behavior change that's really meaningful and that actually is going to help both the patient and the caregivers going forward. So always, 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 as you guys know, if you've been listening to this podcast, we always want to delve deep into that physical medical presentation. So the diagnosis is really important. And here I just want to put a little caveat on, establishing a diagnosis is usually reserved to veterinarians or for veterinarians. So we are the ones that are actually able to take all the information that we're given to observe the animal, whether that's through videos or in person, which is my preferred option, and to collect all that data together and to try and understand what's going on, and what kind of diagnosis or diagnoses, because often there are more than one we're dealing with, and that will inform us in terms of moving forward and choosing the right kind of medications. Now, I'm not saying that other pet care professionals, especially those trainers that are really, really great at observing their patients, that they don't have an inkling about what might be going on, and that's something that they can absolutely communicate to the veterinary team, share their observations, share what they think might be going on, and that will definitely help. But the actual diagnosis piece is definitely a veterinary piece. So that's a really big caveat is the diagnosis piece. Now, the third piece is all about neurotransmitters, and this is such an important thing. Now, if you've listened to episode 39 of this podcast, you'll have heard me talking a little bit about brain health and how neurotransmission is really, really important here. If you haven't listened to it yet, maybe go back and have a listen, because neurotransmitters are everything. They're everything. And so again, what are neurotransmitters? So neurotransmitters are chemical substances that facilitate the communication between neurons in the brain. And we can have excitatory neurotransmitters that cause subsequent neurons to become more excited and to fire more. And we can have inhibitory neurotransmitters that cause subsequent neurons to not fire and to kind of have an overall calming effect in the brain. And we probably have about 6 big players when it comes to neurotransmitters that we're thinking about. And those are GABA and glutamate. So GABA is your main inhibitory neurotransmitter in your nervous system. Glutamate is your main excitatory neurotransmitter. So balancing the two of those, understanding if perhaps glutamate is being too active and causing too much excitation in the brain and too much firing in the brain. We might, want to increase GABA, which helps to kind of calm and put an overall sort of calming blanket over the brain, if you like. That's, a very sort of abstract way of looking at it. But glutamate and GABA are definitely two big ones, and they're very widely spread throughout the brain. So, for example, glutamate is involved in probably about 75% of neurons in the brain. So it has widespread effects all throughout the brain, from the brainstem to the cortices. So, from the back of the brain to the front of the brain is a really important neurotransmitter, and is also the neurotransmitter that's involved in epilepsy and seizures. So if we have an overactive glutamate system, you're more likely to get perhaps seizure activity. So that's something that we really want to think about, that excitatory piece. So those are GABA and glutamate. Then we've got 3 really important neurotransmitters, which are called our monoamine neurotransmitters. And you'll all have heard of these before. So we're talking about serotonin, dopamine, and norepinephrine if you're American, or noradrenaline if you're not American. So these are 3 neurotransmitters that are very much responsible for different things. And we're going to dive deeper into each of these neurotransmitters in some future episodes to really hone in on what these individual neurotransmitters do. But one thing to say is that all of the neurotransmitters somehow are interconnected. So it's not as simple as looking at serotonin in isolation, or dopamine in isolation, or noradrenaline in isolation. They all have kind of knock-on effects on each other. So if you have an effect on serotonin, that's very likely to have what we call downstream effects also on dopamine and potentially noradrenaline. So some of these kind of interactions are not super clear yet, but we do know that they do exist. So if you're influencing one neurotransmitter system, you're probably also influencing the others. And having a bit of an idea of how that works is really important. And when you're looking at a diagnosis, it might be that you want to target a few different neurotransmitter systems at the same time, whether that's, for example, GABA and serotonin in cases of fear and anxiety, perhaps also aggression, right? GABA and serotonin would be 2 big ones there, but also noradrenaline. So noradrenaline is a neurotransmitter that causes our patients to be very hypervigilant and hyperattentive and very tuned into their environment. And while sometimes we might want that, other times we don't want that. So again, going back to these reactive patients, they probably have an overstimulation of the noradrenaline system where they're very, very hypervigilant to their environment. And that might be detrimental to them because they're not able then to regulate their responses because they're in this kind of extreme sort of firing situation. Noradrenaline is also very much responsible for our fight and flight responses. So we have an autonomic response there, right, which goes through the hypothalamus. So it has a couple of different modes of action. And again, don't worry if this all seems a little bit much. There's, I'm giving you quite a bit of information here. We're going to dive into these individual systems in future episodes and really break it down and really help you understand where what each neurotransmitter does and where we might be wanting to look at our sort of medication choices there. And what's important here is that the medications that we choose have primary actions at specific neurotransmitters. So, for example, your alpha-2 agonists, which is, for example, your Cilio, dexmedetomidine gel, or a mucosal gel, or your clonidine, that targets the noradrenaline system, whereas your SSRIs, so your fluoxetine, for example, primarily targets the serotonergic system. So you can start to see how understanding which neurotransmitters might be involved in unwanted behaviors informs us as to what medications we might want to choose. And it's complex, and it's something that's not particularly straightforward because of some of those interactive connections in the brain between neurotransmitters. But we absolutely want to have an understanding of that, which is really going to inform our medication choices. So neurotransmitters, big piece. So that was number 3. So just to recap, we've had number 1. I gave you a bit of a definition of what psychotropic medications are. Number 2 is we need to get a diagnosis to understand what we're wanting to treat and what we're wanting to achieve. Number 3, we have to have an understanding of neurotransmitters to know what medications to choose, which medications target which neurotransmitter systems, and again, what we're hoping to achieve by that. Now, number 4 is we want to have the idea that our medications fit into a more comprehensive treatment plan. So I always say medication alone is not going to be your golden ticket. It's not going to be the magic piece that suddenly helps everything fall into place. Yes, medications can support, but that doesn't mean that we can ignore all the other pieces of our treatment plan. They're still very, very important. And if you want to have a bit of a recap on what goes into a treatment plan, then have a listen to episode 5, a really early on episode of the podcast, where I actually talk you through the different components of a veterinary behavior treatment plan and where medication fits into that piece. Now, one really important piece here is how medication interacts with learning. So what we see time and time again is that patients really struggle to learn because their neurotransmitter system is a little bit out of kilter and learning can't take place. Let's say you have a patient that's extremely highly aroused, and many of you will be able to relate to this. If they see that trigger, let's say you're out on a walk and you are faced with another dog, an unfamiliar dog, and your dog really reacts and responds to that, you could have steak raining down from the sky and your dog would not be able to be distracted from that trigger that they've seen. So again, it depends a little bit on the intensity of the reaction. Some dogs are able to be distracted, but the majority of cases that I see, and I see sort of the sharp end, I guess, of the cases, is those dogs go into such a fast and quite substantial reactive state that they can't be distracted. Nothing else in their environment matters in that moment. And they're really, really focused on that trigger. So a big piece of using medications is to actually get the patient to a state where they can learn again. So if we reduce their arousal and then we're all of a sudden able to distract them and to start implementing counter-conditioning, classical counter-conditioning methods, or maybe desensitization methods, and we're able to give them strategies where they can slow down their brain and they can start thinking about other things, that's a massive piece when it comes to learning, because we know how important behavior modification is as part of that comprehensive treatment plan. Similarly, we want to use our environmental management pieces to actually prevent, especially initially, prevent the dog from being exposed to some of these triggers. Because every time the dog is exposed to a trigger and their brain goes through that same reactive pattern, it's going to strengthen the pathways that are responsible for that quick fire reflective reaction. And we know that every time the dog practices that behavior, it's going to be harder to undo. Every time we strengthen that neurotransmitter pathway in the brain, it's going to be more difficult to undo. We actually have a law called Hebb's law, which says, what fires together wires together. So if you have certain neurons that are firing together on the back of some of these sort of reactive events, they're going to wire together and they're going to build these really strong neural connections that are difficult to undo. So we absolutely need to be looking at our environmental management. We need to be looking at our behavior modification. Obviously, as I mentioned, we need to be ruling out any physical medical contributions, because they have a part to play in the brain as well, and in some of these kind of neural connections and neural pathways. We want to be optimizing diet. We want to be optimizing, ideally getting a patient pain-free. We want to be addressing skin disease. We want to be addressing gastrointestinal disease if that's present. So it's part of a comprehensive treatment plan. And I think sometimes the mistake that we make is we think, yep, we're just going to use meds. And I've seen that happen, especially in cases that are referred to me where vets have prescribed medication and they're absolutely trying to do the right thing. But it's without everything else that goes around it. And in my experience, and we actually have data to back this up, it doesn't work. So we have some studies on separation anxiety in dogs, the Reconcile studies that were done in 2007, 2008, where we have one study that uses behavior modification and we have one study that does not use behavior modification. And certainly the patients in the study where behavior modification was used definitely had a more favorable outcome. So I know it from experience because I've seen it happen time and time again, but we also have that research to back that up, to tell us that behavior modification is an important piece in that treatment plan. So that's really important. We can't just, dispense meds without implementing all of those other pieces. So that is the part of the comprehensive treatment plan. So that's my number 4. And then finally, we want to actually consider the patient. No, well, not we want to. We have to actually consider the patient, because each patient is an individual and we need to understand, whether medication is going to be appropriate for them. And I'll go explain what I mean in a second. And whether actually it's safe to give them medications, because of course our veterinary oath states, first, do no harm. So we want to make sure that we're not actually giving our patients something that is potentially going to cause them to have negative, either negative physical effects or a negative emotional response. So that first do no harm piece is really, really important. And secondly, and this is something that clients say to me so much, is, they don't want their pets to be turned into zombies. And those are literally the words that are used, right? I don't want my pet to be a zombie or to just be kind of lying in the corner and not behaving at all. I don't want medication to change their personality. We love their personality. We still want them to be that same personality. And so it's really, really important that we take all of that into consideration. Now, we do have some medications that can potentially have a bit of a sedating effect. And oftentimes this is a side effect that goes away after 2-3 weeks. And that's something that we absolutely need to educate clients on. And oftentimes, those side effects are short-term for a longer-term gain. But clients need to be aware of that. They need to know, okay, for the next couple of weeks, my pet might sleep a bit more, which might actually be a good thing. Their appetite might decrease for a couple of weeks. And we want to make absolutely sure that we're monitoring them on a very frequent basis. And I do an every 48-hour monitoring protocol, especially in the first 2 weeks of starting medication, to see, do we have side effects? Are the side effects to a point where we want to maybe decrease the dose or go to an every other dose, or maybe choose a different medication if they're side effects that are not beneficial, or that are very severe and are really causing a problem. So those things are important. So we need to understand the medications well. We need to be informing caregivers that, hey, this could happen, but I completely expect this to go away after a couple of weeks. If it doesn't, we need to think again, because it's all about the first do no harm piece and making sure that we're really supporting our clients through especially those first couple of weeks. Now, we have some medications that interact with other medications. So let's say, for example, your pet is on another medication, let's say a heart medication, for example, or they're on thyroid medication, or they're on kind of any other long-term medication, maybe even a long-term sort of non-steroidal medication, a non-steroidal anti-inflammatory medication for pain. We need to know that some of our psychopharmaceutical medications can interact and interfere with those. So we need to really be aware of how that might play out. And again, we might be adjusting doses or choosing different medications to accommodate for that. So we want to know, is your patient already on a medication? And not just medications, but also natural supplements. So we have some natural supplements that can really interfere with our psychotropic medications. And the two that come to mind here are St. John's wort. So that's a really big one. And the other one is all the CBD products. So they actually interact with some of our serotonergic receptors. So that's a really important piece. So we really need to be understanding that, educating clients on that, maybe deciding to cease some of those supplements. In particular, we might not be able to stop other medications because they're important for other disease processes that are going on. But it's really important to understand that piece. We want to understand the age of the patient, because there are going to be some medications that we don't want to use in an older patient, especially those medications that maybe have anticholinergic side effects. So we really want to be looking at the age, the overall health. Are they taking any other medications? Are we going to be doing any kind of harm? All those things that we need to consider. And then finally, of course, we want to be following our cascade. So we want to be thinking about, is the medication that I choose licensed for the species, for that particular indication? And we do not have many of those. We have 2 medications that are licensed for separation anxiety. We have a couple of medications that are licensed for storm phobias, noise phobias. We have a medication in cats that's licensed for pre-veterinary visits. And we have a medication that is licensed for canine cognitive dysfunction. So that's pretty much all we've got, which is not a lot. Everything else is off-label for that species and for that indication. So we want to be making clients aware of that. We need to get informed consent, and they need to be fully educated and understand that. And even though a lot of medications aren't licensed, because licensing takes, a lot of time, effort, and money, we do have peer-reviewed papers on some of those other indications that are not licensed. So we can say, hey, the medication is not licensed. For example, let's say the medication isn't licensed as an add-on for fear and anxiety, but we do have a great paper stating that clonidine is a good add-on for fear and anxiety, or that trazodone is a good add-on for fear and anxiety. And we've got some, good evidence, some good research, some good papers to support that. So you always want to be thinking about that piece. And then finally, are 2 relatively sort of logistical pieces. But number one is the medication even available in your country? And being based here in the UAE, that's something that I struggled with a lot at the beginning as I was setting up my veterinary behavior service. There weren't many medications that I was able to get hold of. Over the years, that's changed a lot. I've had to do, a lot of work with the ministries to allow me to use some of these medications. I've had to evidence that I'm, in a residency and what these medications are being used for, and to supply evidence and, papers to support that. But that's a big piece. And still to this day, I struggle to get some medications. I struggle to get some of the benzodiazepines, especially the controlled medications, right? So benzodiazepines in the US are a Schedule 4 medication. So that's something that's tricky. And even gabapentin and pregabalin in the US are Schedule 5 medications. So some of those controlled medications are a little bit more difficult for me to get hold of. And if you're perhaps anywhere else in the world other than maybe, Europe and the US, it could be that you really struggle to get those medications. There have been so many times where I've thought, oh my God, I really want to use XYZ medication, buspirone, for example, which I do now have, and I just didn't have it. And there are times where I would really love to use a benzodiazepine. I'd love to use lorazepam in cats, and I just don't have it. So those obviously are going to be restrictions and are going to influence what medications you use and you choose. And then finally, actually administering the medication to our patients. And obviously cats are a big one here. So we know that cats can be notoriously difficult to medicate on a long-term basis, on an everyday basis. And you have to get really creative to find ways that are not going to stress the cat and that are not going to cause a breakdown of the human-animal relationship because, the client is administering the medication every day. So we really have to be thinking about, how are we going to administer these medications? How good is the dog or cat at taking meds? That might influence whether we choose a medication that only needs to be administered once daily versus twice daily, for example. And what are some creative ways that we can think of administering those meds in a stress-free way? And I have to say, I've had probably 3 patients in the last 5 years. So I've seen over 400, almost 450 behavior cases now. And out of those, obviously I haven't administered or recommended medication to all of those, but to the majority of them, I've had probably 3 patients where administering medication just hasn't been possible, either because they've responded aggressively or where it was just a real challenge to administer medications. And that, of course, is going to influence your outcomes. So that's something to massively think about. And yes, if you're very, very fortunate and you have compounding pharmacies near you, you can see if those pharmacies can compound the medications into a liquid form or into a palatable chew form, for example. In the US, again, my colleagues are very, very lucky in that there are great compounding pharmacies that can support with that. That might not be available in other areas of the world. And then we've also attempted, other ways of administering medication, for example, transdermally in cats. So we have a couple of papers looking at amitriptyline and buspirone and also fluoxetine. More recently, we have a paper on transdermal gabapentin. But unfortunately, all of those papers are quite similar in that they don't record good bioavailability. So transdermally, you maybe only get 5 or 10% of the drug actually reaching the bloodstream and being bioavailable, which obviously means that we're either going to have to administer the medication at such a high dose transdermally, and that can become irritating. So, the gels that we use can cause hair loss and, can be irritating to the skin. So those often also aren't viable options. So just from a really practical standpoint, medication might not be possible for all patients simply for the fact that we can't administer it. So those are my kind of top five. There's a lot more to delve into, and I'm going to be doing that piece by piece as we go forward with our podcast in year 2. But it's just to give you a bit of an overview of which patients might be suitable candidates for medication. And if you're a pet owner listening to this, whether your pet might be a good candidate. Maybe, that they have a behavior problem, and you've maybe, tried training for long periods of time and the training isn't really helping, or you've hit a glass ceiling and you just can't move past that point. or maybe you have a pet that's really scared of going to the veterinary clinic, and you dread every time their annual vaccines are due, or you kind of perish the thought that anything happens to your pet on an emergency basis where you have to take them to the vet in an emergency situation because you know how fearful they are at the veterinary clinic. So, those are definitely the patients that we would look at and see if we can find a psychopharmaceutical plan for them that will help them in those situations. So if you're a pet parent and you are thinking, gosh, maybe medication might be useful for my pet, if you're a vet nurse, a dog care professional, a trainer, perhaps a non-veterinary behaviorist, and you feel that medication might be something that could support your pet or your patient, please get in touch with a veterinary behaviorist, whether that's myself. I'm happy to take vet-to-vet consultations. I'm happy to offer virtual consultations if you're not based in the UAE, or in-person consultations if you are based in the UAE. I have a lot of clients in the UK, so definitely it's something that we can support with. If it's overseas and I don't have a license to practice in that country, then it would be with the help or with the support of your general practitioner vet, if they're open to that. So there are definitely ways in which we can support. So finally, before we end this podcast, I'm just going to let you know that I have an hour-long webinar on psychopharmaceutical medication. It dives a little bit deeper into the points that I've touched on today. It kind of gives you the who, when, and how of using psychopharmaceutical medication. If you're interested in that webinar, now is the time to get that. It's $19 to purchase, which is, really not too much to pay for a little bit more in-depth information around this topic. However, this webinar isn't going to be available for much longer because I'm going to be offering something that is super exciting and is going to overtake the webinar. It's going to be a course that's going to come out in the next, hopefully 6 months, which is going to be super, super amazing. And it's going to be for vets, pet care professionals, but also for pet owners if they want to have a bit of a better understanding. So if you want to grab the webinar, grab it now. I'm going to put the link in the show notes, and the link is going to be on our social media as well. It's a really good introduction and easy to listen to, an hour long, just kind of explaining in a little bit more detail about what I've spoken about today. So grab the webinar if you want to get that before it disappears. It's definitely well worth the $19. Okay, so as I mentioned, next week we're going to look a little bit into the difference between what are long-acting medications, what are short-acting medications, what do we use them for, how can we use them together to get really great results, how do we use them on their own to get really great results. So that's going to be next week's webinar, so next week's podcast episode. So if you enjoyed today, then definitely check out next week, because it's going to start putting the layers on top of the foundation that I have built here today. All right, I hope you've enjoyed this episode, and I really look forward to chatting with you guys next week. And remember to grab that webinar if you're interested. All right, thanks for tuning in, and I'm going to see you next week. Bye for now.